The Deuk Spine Institute. We're performing live spine surgery here, December 16, 2025. This will be one of our last days of surgery before Christmas and the New Year. We are going to be operating on Thursday as well. This patient comes from Florida. She's had back pain now in her lower back for 4 years. We diagnosed her with 2 discs and 4 facet joints causing her pain. The 2 discs we're fixing from the left side today. I'm going to be injecting a little numbing medicine under the skin, and she is resting comfortably for now. We'll wake her up shortly and we'll do our discogram, verify that those discs are indeed the source of her back pain. If you have questions, feel free to type those questions up. Henry will then relay your question to me, and I will answer your question during the surgery. We like to do question and answer. It keeps the audience engaged. And before we get any questions, Henry, would you mind sharing with our audience the 30 different causes of back pain, chronic back pain? And just for those who have not seen this video, chronic back pain is back pain that people have for more than 2 weeks. That's the medical definition of chronic. So, can chronic back pain be cured? Absolutely. What do you need to cure chronic back pain? You need a diagnosis. That's first and foremost. What is the cause of chronic back pain? Yes, there are very specific causes, but each patient's cause will be slightly different. It'll be one of these 30 causes, but the combination of causes varies depending on the patient. So the first thing we have to do is make a diagnosis. Let's share with our audience the 30 causes of back pain. AP? I'm Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majin. Thanks for joining us. Welcome back. While you guys were learning about the 30 different causes of back pain, the most common cause of back pain is the disc injury called an annular tear. That's what our Deuk laser disc repair procedure fixes. This patient came here specifically for the Deuk laser disc repair to get rid of her back pain. That's what we're doing today. We just did a discogram on L5-S1, and it turns out she has 10 out of 10 pain that's concordant at L5-S1. Are you comfortable?
Are you doing okay?
Is the pain gone? All right. How bad is that on a scale of 1 to 10? What's the highest?
8.
All right. So the other one was more painful. Yeah?
Yes.
Is that where you
Just
get...
a little more painful, the other one.
All right. Is that where you get your back pain?
Yes.
Congratulations. We have a C for concordant, but it's also for congratulations. When you wake up, that pain will be gone forever. So, we just verified that the L4-5 and L5-S1 discs are indeed the cause of her back pain. We're going to put her to sleep. When she wakes up, that pain will be gone because we're going to go in and take it away. What is the success rate of the Deuk laser disc repair at eliminating disc pain from an injured disc? The answer is 99.6. We treated 5,000 patients with chronic back pain. We looked at 5,000 patients, actually, I should say. And it turns out that 85% of those patients, their pain was mostly coming from the disc. A disc injury, like a herniated disc or bulging disc, or degenerated disc. And by the way, there are many different names for disc injuries, but they're all the same. We call them here herniated discs. Now, herniated discs cause inflammation. And inflammation is your body's own system trying to fix that disc. But the problem is that your body's inflammatory system can never fix the disc herniation. All it can do is try to fix it. So your body undergoes inflammation in the back of the disc for 20, 30, 40 years, as long as it is. And people have back pain for that long because their body is trying to heal the disc for 10, 20, 30, 40 years, however long until they get into Deuk spine and get it fixed. Now, That inflammation is your body trying to heal the disc, but it just cannot because there's a piece of herniated nucleus stuck inside the tear in the back of the disc that's preventing the disc from healing. Let me know when I can proceed. And what we're doing today, using the endoscope and laser, we're going to find that herniation stuck in the back of the disc tear, and we're going to clean it out, called a debridement, so that she can have no more pain. The success rate of our patients is literally 99.6%. That's our average, meaning most people have 100, some people have 90, but the vast majority are 195%. That's called patient-reported outcome, meaning we ask our patients. We don't go anywhere else for success. We go directly to the patient because it's the patient who came to us with back pain. So we want to know from the patient, how much pain do we get rid of? That's all that matters, folks, is what the patient says. It doesn't matter what an MRI says or what an X-ray says. What matters is the patient's life. If the patient's pain is gone and they can go back to a normal life, that's a success. Our procedure is 99.6% elimination of pain. All right, we're going to have to remove this dilator from the center of the tube, which means I gotta actually work here. Huh?
You got it? Yeah.
Is your tube moving? No. All right. If you have questions, feel free to ask. But the important thing is we just confirmed that those two discs are causing her pain. One was an 8 out of 10, the other was a 10 out of 10. And if you watched our video on the causes of back pain, you see that there are 30 specific causes. There are 5 discs in the lower back that can cause pain. 2 of them are the most common, L4-5, L5-S1, that's what she has. There are also 10 facet joints. 2 of them are the most common, L4-5, L5-S1, and it would be 4 facets because it's bilateral. After that, everything else becomes less common. So in her case, she has both disc pain and facet pain. We are inside the L5-S1 disc. You can see that inflammatory tissue I was talking about right there. You guys see the color of it? It's kind of pinkish.
Yes, we do.
I'm trying to resolve this image a little bit better. And there it is. So inside the L5-S1 painful disc, is she okay?
Yep.
This was a 10 out of 10. And I'm removing some of the herniation, the nucleus. And you can see the grabbers don't do very much. Compare that grabber to the laser. The laser is far more efficient at removing disc herniation and scar tissue, calcification, inflammatory tissue. Those are really the 4 things we're removing here. We've even had patients that came to us with infections. They had surgery done elsewhere on their disc. They had an infection of the disc afterwards called discitis. They came to Deuk Spine. We went in just like this, and we cleaned out the infection using a laser and an endoscope and surgical instruments. We did it transforaminal like we're doing now, and the patients went home without the infection, and they're back to normal. We also can put in antibiotics into the disc where the infection is, so we can actually treat infections as well. Thank God there's not a lot, but it does happen. Specifically discitis, it can be treated. Discitis is an inflammation or infection of the disc. All right, I'm just using my laser to go around the herniation and try to remove it. You could see the laser is far more effective than the grabbers. Now, doctors who tell you laser spine surgery is a gimmick, it's a joke, that's because they don't know how to properly use the laser. The laser can be properly used only when it's combined, in my opinion, with endoscopic visualization, which means you use the endoscope to see what you're doing. Here's why. That fiber you are just looking at is 1 millimeter wide, 1 millimeter. Now, if you take your fingers and put them in front of your face and open your fingers just enough to get a crack of light between them. That space is 1 millimeter. And the fiber we're using is that diameter. Now if you look at it here under the endoscope, it doesn't look that narrow, does it? And that's because endoscopic surgery uses magnification and illumination to allow the surgeon to see better right inside smaller areas. So the tube here, this diameter of the tube is about 5.5 millimeter, 5.5, very, very small. And that's the internal diameter of this tube. That laser fiber you're seeing right there is 1 millimeter, 1 mm. That's the space between your finger, barely enough for light. Now I want you to pay attention to the area that's at the end of that glass fiber. That's the herniation that I'm removing by touching it with the tip of the laser fiber. The tip of the laser fiber is where the laser energy is released, and you can see how easy it removes this very densely scarred tissue. Okay? This stuff here is calcified, it's scarred, we call it collagenized material. And the collagenized herniation is very hard to remove, which is why you cannot remove it using grabbers. And that's why surgeons who don't use a laser, which is 99% of spine surgeons out there, they don't use a laser. They cannot clean this tear properly to allow it to seal. That's why reherniation rate, disc degeneration rate after microdiscectomy without laser is so high, because the surgeons are not properly treating the annular tear. They're leaving it open, and the body cannot seal this as long as there's all this junk here. The only way to get rid of it is to use the endoscope and laser together. That's what I pioneered. It's called the Deuk laser disc repair. It's an annular debridement. We're the first in the world to do it and the first to publish it. And it's unique to Deuk Spine Institute, the Deuk laser disc repair. If you want the very best of endoscopic surgery or spine surgery, or the endoscopic spine surgery or endoscopic laser spine surgery, you come to Deuk Spine.
We have a couple of questions.
Sure, I'll take them.
First one from AAKK on YouTube.
All right, AKK. I know AKK is a physician watching our surgeries, learning our techniques.
Indeed so. Asking, hi, Dr. Deuk. When you insert the endoscope, how do you know which part of the posterior annulus to laser if there are multiple cracks in the disc, central posterior and posterior lateral tears, for example?
That's a great question, doctor. The answer is the anatomy of the disc guides me. And we use that discogram ahead of time, remember, to visualize the tears. So that's very helpful in terms of guiding my treatment of the annular tear. Discography, experience, and good visualization with the endoscope, and good navigation with the needle. Combining all those things together, plus all my experience, gives me the right coordinates and directionality to use in order to get to the areas that I want to treat. It's a great question. We're just about finished with this disc. You can see we're getting close to the outside of the tear.
We have another question.
Sure.
Coming from Juanitos on YouTube.
Hello, Juanitos on YouTube. Welcome to our live stream. Thank you for joining us.
Asking, who does this procedure in California?
Great question. Nobody in California does the procedure, Juanitos. We are the only ones, Deuk Spine Institute, that does the Deuk laser disc repair. This is a procedure you should travel
to Florida to get it done properly. Remember, I make it look easy, folks, but there's a lot of chance of injuring the patient during this kind of surgery if you don't know what you're doing. So you don't want to just go anywhere. Doctors are not equally trained. Something you have to remember. Just like not all burritos are created equal. I say that because we had burritos for lunch and they were phenomenal. They were made by Dr. Berndez's lovely wife. She brought them in for the staff, and I have to say I had a lot. Actually, I had enchiladas. So just like if there's 100 chefs, there are 100 ways to make a burrito. And if there are 100 surgeons, there are 100 ways to do surgery. You really want to pick the best for yourself, okay? Life is not a burrito. The fact of the matter is, if you have a bad burrito, no problem. It wasn't exactly what you expected. You go somewhere else the next time. But when it comes to spine surgery, you only have one chance to do it right. And if the surgeon doesn't do it right, they mess your back up or your neck up, you're going to wish to God you never had the surgery. If you don't believe me, go on the internet and you'll see millions of people writing comments about their spine surgery that was botched, that had a bad spine surgery. I wish they never had it done. You never see that from Deuk Spine Institute. The only patients that complain with our patients are ones that did not do the surgery we told them to do. So we tell people exactly what surgery they need, but some people say, oh, I don't want to do all that, I just want to do one thing. And they choose what they want to do. Well, if you have 5, remember the video, there were 30 different causes of back pain. The average patient has 5. If, 4 or 5. If you have 5 causes of back pain and you only fix 2 at Deuk Spine, well, of course the other 3 are still going to hurt you. And they may even hurt more after the surgery because now your brain is paying attention to those pain instead of the one you used to have. All right, we're almost done at the L5-S1 disc. Great question, but this procedure is only available at Deuk Spine in Florida. Someday, I would love to have a place in California. After all, I'm from California. For those of you who don't know, I trained at USC in Los Angeles Medical School. And that was a top medical school in the country and world. I graduated valedictorian, #1 in my class, and went on to do my neurosurgery training at University of Florida in Gainesville with Dr. Roten and Dr. Friedman, Dr. Art Day, Dr. Rick Fessler, Parker Mickle, Pat Jacob, Jeff Henn, Stephen Roper, Glenn Rectine, Kelly Foote, Rob Miracle. I mean, the list goes on in my faculty. Point is, the University of Florida was #1 in the world for neurosurgery, according to the most important determining factor, which is Dr. Marty Weiss, who was the chairman of the Residency Review Committee for Neurosurgery for, many, many years. And he felt the top program in the world was Gainesville. He even was the chairman at USC. So when I asked Dr. Weiss, should I just stay at USC for neurosurgery, he said, no, you should go to Gainesville. I want you to get the best training. And then you can come back to USC when you're done. Well, I never made it back to USC. But I decided to live in Florida because, well, my staff need a job, right? And we got the best burritos right here. Why would I go back to California?
I never really had too many bad burritos when I lived in UCLA, though.
You didn't have too many bad burritos?
I lived in Los Angeles.
Yeah, when I lived in LA at med school, that's what I ate almost at least 3 or 4 times a week. I ate a burrito, carne asada burrito. down the street, there was a little burrito shop from the medical school. And I would walk there and have dinner, burrito. I told my family I lived off the Mexican fruit stand. They would chop up pineapple, cantaloupe, honeydew, mango, and put it in a bag. Yeah, and you would buy it, like a bag of that, for like $3. I had to live off $10,000 a year. That paid my rent, room and board, my food, my rent. 10 grand a year, man. Can you imagine people living on 10 grand a year? Huh? Machaca. Well, machaca was my favorite. I had machaca in San Diego at Roberto's. But in Los Angeles, they didn't have Roberto's in Southeast LA. This was, gang central. They had a lot of gangbangers. They had very little restaurants. Huh? You guys were at UCLA. I was at USC, Southeast. It's where the Bloods and the Crips would wage war every night over their territories. And we would have them, the gangbangers would come in every night to USC County Hospital for surgery because they were shot up, dying. And the orthopedic surgeons and general surgeons were up all night, literally 24/7 operating on these people.
Is it true that the Army used to actually come and train at USC
Yeah.
for trauma surgery?
Uh-huh.
I heard that.
Yeah, the Army did. The Army surgeons. Yeah. Yeah, it was a war zone, Los Angeles, back in the 80s and 90s. I don't know. I haven't been back. I haven't been back. All I know is it was an incredible experience, opportunity for me to learn. I had literally the finest training in med school and neurosurgery training. I was very fortunate. God was smiling on me at the time. All right. Any other questions or comments?
Yes, we have a question coming from AAKK once more on YouTube.
Uh-huh.
And it says, maybe an off-topic question. Have you spoken with any physicians or neurosurgeons who are actively looking to lobby for this procedure to be instituted into practice?
That's a great question. I actually spoke to one last night in Portland, Oregon. The problem is, I'll be honest with you, most surgeons and doctors have no clue how to lobby. First of all, they don't have any clue about reimbursements. And they're starting to learn. I'm starting to see that they're learning because they're running. See, medical practices are businesses. You have payroll, you have rent, you have supplies, you have a lot of overhead. We have massive overhead we have to pay every month. So if you're a doctor in private practice in the United States, you got to have some business skills to be able to stay in business. Because what's happening is the insurance companies are making it every day harder and harder to get paid. It's almost impossible to make money in medicine now. The insurance companies make all the money, they keep it, they don't want to pay for patients' medical care. So to be a doctor in private practice, you got to understand reimbursement, expenses. You got to be a real businessman. And in the old days in America, doctors were paid so much money and their overhead was so low that you could be a terrible business person, a man and woman, and still have a medical practice, right? You could be wasteful and you could be just not a good business person, not able to save money, and you still stay in business because you got so much money from the insurance and the overhead wasn't so bad, it was low. Now overhead is massive. I'll give you an example. My father was a doctor back in the 80s, 70s, 80s. He had 2 employees, 2 people that worked in his office. He was a surgeon, OBGYN. And he was a faculty at USC, taught the residents in OB-GYN. But the point is, he could run his business very easily with only 2 employees. Now, with all the demands of the insurance companies, medical record systems, supplies and regulations from the government, the insurers, to be able to practice medicine, you have to have 20 employees per doctor. Remember, my father was a doctor, he had 2 employees. So it was 2 to 1, 2 employees per doctor. Now it's 20 to 1. Okay? Just think about that. That is a massive overhead increase. That's what is that, 10 times? That's a 1,000% increase in overhead, just in employees. Of course, rents have gone up. So what I'm getting at is it's very difficult to run a medical practice. And the doctors that are coming out of training that want to have their own private practice, they don't know how difficult it is, and they don't know how to run a medical practice. So many of them are just settling for being an employed physician. They work for somebody else, like a hospital or an insurance company. Did you know that United Healthcare has employed 10% of the doctors in America? This is an insurance company. Is now hired 10% of all the doctors in America, an insurance company. Unheard of in the past. Kaiser Permanente is probably the second biggest employer of physicians. Another insurance company that's employing physicians, right? Kaiser. They were the first HMO, and they're owning hospitals. So these insurance companies are now owning doctors and hospitals. And by doing that, they can control the doctors. They can control their expenses. They can deny the doctor's recommended treatments. Easy, because they're the employer. They're not just the insurance company, they're the employer. So when you ask about doctors lobbying for what's best, you got to first understand these doctors don't know what to lobby for. They have no clue what's wrong. They think everything's okay. They don't know that the system is broken and that they're not doing anything to fix it. So if the doctors don't understand what's wrong with the system or how to fix it, they can't explain it to the patients or to the public. So there's only a few of us like me that run businesses and have done it for 20 years and are smart enough to see the truth for what it is, that the insurance companies are destroying healthcare, that we can actually are motivated to do something about it. So that's the problem. There's not many doctors that understand the economics of the revenue cycle and reimbursement, to understand the nuanced issues that are arising because of the policies and practices of insurance companies to deny treatments and payments. And those that do, and more doctors are starting to get smart about it, they're starting to mobilize, but they only represent about 1% of the physicians out there. So there's not enough doctors that understand the problem, the scope of the problem, to be able to fix it. That's the problem. So I'd say I don't really see it happening. That's why we do our stream. We're doing our stream not just to teach everybody that we can now cure back and neck pain at Deuk Spine Institute, and that people don't have to have invasive surgery to feel better, but they can also get a treatment that's permanent. We're also doing this to teach you guys about the insurance companies and how they've hijacked our healthcare system and are destroying it by denying treatments and paying for treatments for patients needed treatment. So I don't think there's many out there that are politically active for the right issue. I'd say maybe less than 5 if I had to guess. Next question.
No current questions, but we do have a comment from AAKK once more on YouTube saying, "Thank you, Dr. Deuk, for the explanation. I hope that one day physicians will institute this to all practices with a proven method to reproduce excellent results you attain."
Thank you. I appreciate it. I agree with you. I hope my goal in life is that every person in the world, even in third world countries, people that are poor, that everyone can have this surgery done if needed to get rid of their back and neck pain. And it is possible because the surgery works so well, and honestly, compared to invasive surgery, it's much cheaper to do. If we could just get the regulations right, we can get the right staff trained, the people trained, we can make the equipment affordable, because some of the companies that manufacture this equipment, they price it so high It's obscenely expensive, right? For example, the monitor that I'm using right now to do the laser surgery, I'm looking at a 72-inch monitor mounted on the wall. I had to pay $10,000 for that monitor, $10,000. And I should not have to pay $10,000. I could have bought it for $500. Actually, I did buy it for $500. And then the government came and said, oh, you're not allowed to have that $500 monitor. You have to buy a $10,000 monitor. When I asked what's the difference, they said there is no difference, just the $10,000 monitor has a sticker on the back that says UL listed, medical. So, I mean, this is ridiculous that these expenses for healthcare providers like us exist. They shouldn't exist, right? They should not exist. It's a scam. We got to get rid of all the corruption in medicine to make it affordable to everyone. And then we could fix everyone back and neck pain in the world with the money that's already available. Trillions of dollars wasted in America in healthcare, mostly for insurance company profits, which they don't even claim, even though they're publicly traded. They hide these profits and they go to a few select investors through overseas laundering that's happening, offshore accounts, and then brought back in through, you know, businesses. It could be, all this could be found out by President Trump if he actually invested the time into it. All he needs to do is take all those IRS auditors that Biden hired to audit the hell out of Republicans and take them and have them audit the insurance companies and find where every single dollar goes. You're going to find that 50% or more of the dollars, probably closer to 60, are not spent on healthcare. They're funneled out of the United States. They're funneled into offshore accounts overseas. And these are trillions of dollars every year from the health insurance sector. And I don't know where they're going. I have no idea, but somebody needs to do this. I can't do it. I'm just a doctor here doing surgery. I've already done enough, don't you think? Discovering the cure to back and neck pain. So we need other people to do financial analysis and forensic accounting to figure out where the hell is all the money America's spending on healthcare going. We know there's corruption in our government. We see it every day. The fallout from the Democrat-run government with Joe Biden and his cronies, you know, money, billions of dollars being funneled to all kinds of programs, and then eventually back to, like, I guess President Clinton's daughter was getting millions of dollars from the government through these programs that are fake. Yeah, I mean, this is corruption at its finest, folks. It's got to stop. These are taxpayers paying for people to get rich by cheating the system. We need to stop that. We need to put the money where it belongs, which is the people. The American people deserve better. People shouldn't be sick. People should get access to this. They shouldn't have to pay out of pocket. It should be already paid for. So there's a lot wrong that I could fix, but nobody's asking me. So we have to just broadcast it here on my channel because I'm paying for the channel, but it's a shame we have no financial support from anyone but our patients. Our patients pay for everything we do, and a few insurance company payments, but 95% of our money comes from patients paying for these services. And so we take that money and I put it back into the business, into patient care, not educating and caring for my patients with the best equipment possible. We need help though. We need money from our government or donors so we can do more. But until then, we're going to continue to just be one small little outfit trying to help the whole world. The numbers don't add up. But I appreciate your sentiment, AAKK. Maybe someday I can train you on this procedure so you can take it back to wherever you are and use it for your patients. I mean, train you one-on-one, not just through the internet. All right, you can see the inflammatory tissue there. I need about 5 minutes on this disc. Then we're going to go to the facets. She has not just discogenic back pain, she also has facetogenic pain. For those of you wondering what does discogenic mean, well, A lot of medical terminology is based in Latin. If you take disc is the spinal disc. Genic or genesis is to originate from or come from. So discogenic back pain is back pain that originates from the disc. Is it true? Absolutely. The disc is the most common cause of back pain. Now, if you don't have discogenic pain, you might have facetogenic pain, which is back pain originating from the facet joints. Henry, you want to show the audience what facetogenic pain is and how we fix it?
Of course.
For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back. You can see from our video that facet joints, much like the disc, can be injured through traumatic forces on the spine. When those traumatic forces damage your disc, they also damage your facet. The disc and the facet have about the same amount of range of movement, about 2 to 3 degrees, and then the ligaments that hold the facet bones together, and specifically it's called a capsule, that will tear if you exceed that 3 degrees or 5 degrees of movement. And once you exceed that movement, which is directly proportional to how much force is applied, you're going to tear the capsule or ligament holding the bones together. Once that's torn, it just never heals properly in a lot of patients, and they start having pain from the unhealed capsule that just keeps getting re-injured. And what causes the pain is inflammation. Same thing with the disc. If the disc gets injured, the tear in the back can get a herniation, which means it'll never heal on its own. And that's why we're doing this exact surgery. This right here I'm touching with a laser is the herniation. And it's literally full of scar tissue. All the white stuff here I'm zapping, because the herniation causes the body to react with scar tissue. Look at that. There's the inflammatory tissue right there. That is exactly the source of her pain. And the laser is zapping it away. Like we talked about in the last surgery, inflammation has 4 characteristics: redness, swelling, temperature, and pain. Those are the 4 characteristics of inflammation. You learn that day 1 in medical school. Inflammation is rubor, dolor, tumor, and calor. Calor is temperature. Okay? So, inflammation is pain. It is the cause of pain. And in the disc, it's the annular tear that we're in right now, debriding. In the facet joint, it's the capsule, and the treatment is to kill the pain nerves. That's what we're going to do next on this patient. Any questions?
No current questions, so we do have a comment from AAKK once more on YouTube saying, thank you, Dr. Deuk. That would be wonderful. It is important that every patient has access to this procedure. No one should have to suffer and not know there is a cure for disc pain.
I agree. I want to make that happen. My life's goal is to make this surgery available to every human being in the world so that we can cure their pain. If I could do that, we would cure 85% of back pain. We still need to do the facet treatment, the SI, and the piriformis to get the rest. But between the Deuk Spine Institute's DLDR for the disc, the DPR for the facet, the DPR for the SI joint, and the piriformis release, we can cure 99% of chronic back and neck pain. The rest of it is due to things like fractures and tumors and infections, which we don't really treat. All right.
Oh, we just got a question from AAKK once more on YouTube.
Sure.
Asking, knowing that performing the plasma wanding of the medial branch of the dorsal ramus of the facet joint the facet takes away all pain, would there be any utility in layering the broken capsule of the facet?
In layering it, I don't know what that means. I'm not sure what layering means, but it's impossible to fix the capsule today, and maybe someday it will be possible. It's impossible to mend the annular tear of the disc. All I can do is debride it. Once I've done this debridement, then the body itself will heal this tear.
Lasering, he meant to say.
Oh, laser.
Lasering.
I don't know. I think it would be an exercise in futility. There's an old saying, my friend, if it ain't broke, don't fix it. The Deuk plasma rhizotomy literally works 100% of the time. 100% of curing that pain from the facet joint. Why would you ever do something else? I mean, it's so easy to do, so safe, so quick, and so permanent. Why change it up? I know that we should make progress in medicine. I'm all for progress, obviously. I'm a progressive. But if you have the very best treatment possible, why change it? Why go for something else that's going to be worse? I'm not saying you shouldn't try, but I'm not going to try. Maybe my son will try. Maybe you can try. I don't expect that it's going to be better. Now, can you do a laser medial branch rhizotomy? Yes. But why do the laser? We used to do that endoscopically. It took hours, and all kinds of bleeding and poor visualization. It just never worked. So we changed to the Deuk plasma rhizotomy, which is done in 5 minutes, and it works better. I mean, once I pioneered and patented the Deuk plasma rhizotomy, there's no reason to do anything else. There it is. The tear is now 2 millimeters wide, and it's going to seal itself up. We got rid of the herniation there. Great job, everyone. We're going to move on to the facet joints next. Thanks.